this respect. The other thing that I think came through was the entire training part. I think while there's technology and there may be remote delivery and remote access to specialist doctors, which is what we do, we've realized that training is a huge component. You still have to upskill. The person on the ground still needs to be able to do ACLS and BLS, and they need to be trained on that. They need to be able to troubleshoot a ventilator, or put an IV cannula properly, or make sure the infusion is going in the right manner. So we've been doing a lot of upskilling with our partner hospitals on an ongoing basis. Since we're there 24/7 supporting them, we actually have now structured some of that training that we do for them. And in addition, we've also found that I think that this is my personal belief that we should have more of a physician assistant sort of track for some of these nurses and other staff to move upwards, provide them that upward mobility, because unfortunately every nurse that gets trained is then heading to the Middle East. Instead of that, we have been, at least ourselves internally, we hire a lot of nurses. We have been actually creating training programs for them to actually become physician assistants, right? And that has ensured that they remain motivated, they have upward professional mobility, they're not like looking for the first ticket to the Middle East or wherever it is that they're going. And I think that that's also perhaps something that the government should consider. And I was very happy to hear that you're president of the Nursing Council and part of the Medical Council as well. So if there's any way in which we can collaborate with you in some of these structured training programs and helping some of these medical colleges set up hub and spoke mechanisms for district and taluk and sub-district hospitals, we'd love to collaborate. Thank you.
Thanks, Dhruv. I think very important points, and I think somewhere, we've always followed the legacy of the West, right? And many of those solutions don't work. Like, Dr. Mahajan is saying you need a generalist, right? Because you just don't have. But again, it's siloed. A lot of that, again, a nurse has no career path. I spent about a year at the Mayo Clinic long time ago as a trainee. And what I realized, the nurse was more empowered than the doctors. Literally, the doctors would be scared of getting into without the nurse's permission. So how do we bring that about? And it can be very, very potent. And when do you lose the nurse? When she has the most experience. Either she goes to the Middle East, or she gets married and stops practicing.
Yeah. So first of all, about the St. John's, first things first. So I have been to St. John's thanks to the culture we have in our medical college. So when we usually in other medical college students, when जब खाली रहता है तो सिनेमा जाते हैं, तो BMC में students खाली रहते हैं तो दूसरे hospital जाते हैं. So like that we used to go to Nimhans, and we some connections our PG would take that. Like I came to St. John's for hematology just to see few cases. We didn't have hematology department, and absolutely wonderful medical college. And in Telugu we tell Chitta Shuddhi. I don't know how to tell that in English. It's the purity of mind with which the hospital is running is absolutely. So one of the testimony of humanity being at displaced St. John's Hospital. So I used to also play cricket in the front ground, and this one. So both basically my college and your college is there to serve the people of this country. That's how I look at it. And coming to tele-ICU, like one thing quite close to my heart, and when we were having third year SPM, social and preventive medicine posting, we used to tell, these are all hierarchy, PHC ke upar, CHC hote hai, uske upar hai, like, and I became an IAS officer, commissioner, and I saw that there's absolutely no link. So the PHC medical officer never spoke to the CHC medical officer. CHC medical officer never knew who is their PHC medical officer. So somehow, sometimes, as Dr. Mahajan was telling, so this gentleman, our Honorable CM, probably he was groomed by his father, who was a doctor. YSR was a doctor. He did from Gulbarga Medical College, Karnataka again. So he got it in one of the CM meetings. He was telling, why don't you do this? So a medical college should groom the district hospital. They in turn should groom the taluk hospital. They in turn should do the CHCs. I was like, did you do SPM? So we were taught, in practical it is not there. So thanks to our secretary, it took us some time. So we geographically mapped PHCs to CHC. So now they are in a WhatsApp group. In fact, PHC medical officer, a NEET exam ke liye, they are getting trained from those CHC because they are specialists. So for the first time they came together, and these CHCs are this. So this is what I call as a referral watershed, and if you refer outside, it's a crime. Now we have done this scientifically mapping. So this medical college is grooming this district hospital, and it is grooming this taluk hospital. They are grooming this CHCs. They know what is their team. That's where I can see that we can work. We can put the tele ICU or in the medical college, and it's an option is open to these people when they want to communicate. In fact, we have now a system that's very heartening to see. When basically what Honorable PM says, from lab to lab, lab to lab. We all read that in the book and we started doing it. So now the PHC medical officer calls CHC medical officer, like, should I refer him? This is the condition. He briefs them. He puts the photographs in the WhatsApp message. Now he knows what kind of, and he knows that I have to rush to the hospital now. And same thing they are doing to the medical colleges, and that I think we can connect here, wherein there's a critical patient, rather than putting him on the ambulance and letting him die in transit. So you can connect virtually and say, so this is the patient, what can be done. So that's one thing I think we can go forward.
I think that's sure.
So one of the things that we found often, especially because we are in the genomic space, is that most medical doctors are not trained to understand some of these results, right? So I think medical education, as just as looking at what has happened, I think that hasn't changed much. So I don't know if there is a possibility to actually tweak that, because medicine is now becoming all genomics driven, and if we don't incorporate that within the medical education process itself, I think it will always be left to companies like ours to actually do that counseling, and then it will never scale up to the level that we want to. Right? So I think if we can make those changes at the base level, I think that will make a big difference. The second thing, of course, like I mentioned earlier, I think when you look at genomics not just as something that you do for an esoteric thing, like something that you find it exciting or for a specific thing, but look at it from a screening the whole population. I think that data will be extraordinarily helpful from a government perspective, but that's something that can be thought about, because I think it will give more insights and how to streamline that process rather than.
Because I think a lot of the medical decisions are based on studies done on a Caucasian population, which is true. I think that part. I think there are two areas which doctors. One is the whole genomic, and the second is they're not really trained on nutrition, which is also becoming more and more important. So I think somewhere our curriculum. Before we conclude, something interesting I'll tell you about St. John's, and I had nothing so to do. So one day we was called up by, and please keep this, was called up by the Catholic Bishop Society and said, St. John's is a great thing, works very well, but our Protestant friends make more money from CMC Vellore and CMC Ludhiana. And we did a study to find out why that happens. I won't tell you what the result. I won't tell you the results because that will be breaching. But then I remember going to St. John's and having, some 20 bishops and presenting in front of them and telling them why your Protestants, probably because they protested, are better today. So that's just an anecdote. But I think it's been a wonderful conversation, and thank you, Dr. Vinod Kumar. I think, I've never seen someone come in, be so frank about it, be so receptive. And this is, I think, because the whole idea is we are not separate. The private and public we all have to do it together. And none of us will succeed if we do it individually. And we owe it to our citizens, because as we're moving, and next year we'll probably be the most populous country in the world, we owe it to every Indian citizen. So I'll request Dr. Mahajan to maybe sum up.
Thank you. I think it's been a wonderful interaction, made better by you being there. Actually, we are 3 doctors sitting here, 2 there, so we are in a minority, but not by a long way. I, of course, went to Maulana Azad, and I think it's the best medical college.
Okay, so let me have the final word. I went to Calcutta Medical College. This is the oldest medical college, right? Why they only called it medical college? Because there wasn't anything, right? It became Kolkata Medical College later. So
I think
we've all made a point.
We've spanned, the entire ecosystem of the healthcare delivery system, starting from medtech, both multinational, foreign and multinational Indian. We've talked to genomics, and genomics is the sunrise sector. There is no doubt about that. Even we started as a radiology startup in 1990, and we are now integrated service provider, from hemoglobin to genomics and from X-ray to PET CT, which I think is the future. These silos will break and need to be broken, because there's so much data that for a clinician sitting in his clinic to try to digest and make sense of it, it's going to take him hours, even if he had the intellect to be able to do that. And that's where technology and AI and all of that is going to play a role. We talked about using technology and telemedicine for healthcare delivery. We talked about skilling and upskilling, without which no amount of technology can replace ultimately the human being. It may assist for some tasks, it may even replace, but then it can't replace for everyone. We talked about public-private partnerships and how to have viable, quality partnerships. We talked about some of the pain points, which is about getting money from the government. And so we need to think of innovative ways. We've not faced that problem, in our PPP, because from day one it was a escrow account that was set up. And so, money never accumulates. It's only when money accumulates and you have lakhs or crores to get, that's when, all those corrupt practices come into play. So there are ways to be able to overcome that. And the fact that the government is going to more and more become a payer rather than a provider is also a reality today, and is going to become more and more the reality as we go forward. And that's where the government, we would request, should look at costs for equipment, service delivery, the salaries. My good friend Alok in the morning from UP was saying that we train so many technicians and hardly any get jobs, and if they get jobs they are paid less than 10,000 rupees a month. But then who's responsible? In Hindi we say tel to tilo se hi niklega. Oil you can only take out of the seeds, and so if there's no money in the system, that whole thing percolates all the way down. That's where I think one word which I use always, and which especially in the context of healthcare going forward, where the government may become 60, 70, 75% payer of medical services, is viability. Please look at viability. If things are viable, of course we have to be efficient, we have to be quality conscious, we have to be cost conscious, but if there is viability in the entire ecosystem, you will have healthcare proliferate like never before in this country. And if the government, because of its own constraints, that wants to do so much and has money only to do half of that, then I'm afraid healthcare, especially private healthcare, will face a lot of hardships going forward. I hope that doesn't happen with knowledgeable, passionate people like you at the helm of affairs, and we hope there'll be more and more Dr. Vinod Kumars who we will have in different parts of the country. I'm sure we'll do very well to our citizenry, to our people, because ultimately 5 of us became doctors because we wanted to heal, and in our own way we are trying to do that, and the rest of the ecosystem is going to help us do that. This has been fantastic interaction, and I'm glad we were only these many people in the room and not many more. Thank you so very much for coming all the way, and we hope to interact much more going forward so that we get tangible results. Thank you. अरे वो शेर एक्चुअली हर जगह वही है. विनोद ने नहीं सुना. मंजिलें उन्हीं को मिलती हैं, मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है. मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है. पंख से कुछ नहीं होता, हौसलों से उड़ान होती है. So पंख here is money. But punk is necessary.
Yes. Thank you, Dr. Mahajan, Dr. Mehta, and all the ladies and gentlemen in this hall. I had a wonderful session. I learned a lot. I knew about you, and I would like to thank Honorable CM Y.S. Jagannath Reddy Garu, our Chief Secretary, Dr. Jawar Reddy Garu, my Secretary, Krishna Babu sir, for letting me represent the government of Andhra Pradesh. And I'm sure I have noted down. I'm somebody who notes down, will definitely follow up, and I'm looking forward to collaborate with you. Thank you very much.
Yeah, what?